Welcome to this session of heel pain. What's the origin of heel pain? Why do you get pain? Will be discussed by our foot and ankle surgeon, Dr. Vidyasagar. And he is highly qualified orthopedic surgeon. He got trained in Sweden and other places, and he got a lot of experience and is an exclusive foot and ankle surgeon. He will talk to us for about 10 minutes. Following that, Mr. Ganesan, our chief physiotherapist, will teach you exercises as to how to get rid of heel pain for about 15 minutes. And after this, there will be question and answer session.
Dr. Vidyasagar, as Dr. Devraj introduced, and I'm going to present to you today about heel pain. And it's one of the very common conditions that I come across in my foot and ankle clinic. It accounts to about 1.5 to 2% of the population are affected by this. And the common presentation is like early morning pain. When I get up early morning, I start limping, severe sharp shooting pain in the heel, and it stays for about 10 to 15 minutes. And when I continue to walk, the pain subsides, and after that, I may not feel much pain. This is the initial presentation. But as the patient goes on, after a few months, it may be a continuous feature. There is no reduction in the pain. And some people may present it very specifically in the bottom of the heel, and sometimes there may be an associated or coexisting pain at the back of the heel also. The main reason for this pain is the tightness in the heel cord, or we call it Achilles tendon. Can you do the next slide? Achilles tendon. That is the tendon that is joining from the knee joint, in the back of the knee joint, to the back of the heel, and it continues up to the toes. Can you do the next slide? And this is the one which causes the pain because of the tightness in this muscle. Whether it could be in the calf muscle or it could be in the foot muscle that is at the bottom of the foot. But mainly it is in the bottom of the foot. So as you know that, as I said just now, that the main reason is the tightness in the calf muscle and the foot muscles. The main reasons when we look at it, the reasons are, one is the obesity. The obesity where there is a higher BMI, one of the reasons that causes, your body, your skeletal mechanism or skeletal apparatus would have been made to withstand so much of pressure. But when you put on weight, when your BMI increases, there's a lot of stress going through the heel and the muscles around that. So this is one of the main reasons. The second main reason is, it is the lack of inactivity. In the childhood, in the first decade, second decade, third decades and all, people are generally very active. And as you progress to fourth decade, then you may be slowly go into a type of inactive lifestyle. And that will result in a tightness in your calf muscle. And with the calf muscle, and you know that we all sleep in the night with our foot down. Nobody sleeps with a foot pulled up, because that is a resting posture. So in the resting posture, when the foot goes down, the muscles in the foot, the muscles in the calf gets relaxed. They become contracted. And you get up in the morning, when you try to walk, the muscle has to stretch. And muscle is not able to stretch because of the associated tightness that is present there. And even the same mechanism holds good even during daytime. When you sit for half an hour or 1 hour in an office, at home, when you get up to walk, immediately you'll have a sharp shooting pain for 10-15 minutes. And then when you continue to walk, you may not feel much pain. The reason is, once the tight structure, that is the plantar fascia or the foot muscle or the calf muscle, once it stretches, it is good to put it to any amount of walk, doesn't matter. But once it contracts and again you have to stretch, it will take some time. So that is the main reason that you have pain. And once you have this pain and you have this tightness. When you start walking on these tight structures, what happens is there may be a small micro tears. We say micro tears, that means it is not even visible on an ultrasound, it's not even visible on even latest gadgets of scanning mechanisms, initial days. But the indirect way we can look at it is a bone spur formation. Why it happens is when there is a micro tear, the body tries to repair it by depositing a calcium there. That is what you see the, can you put the next slide? That's what you see in this slide, that you have that calcaneal spur. As that in the X-ray that you can see, and in that diagram you can see the inflammation in that area. So that is the area that typically a patient with a heel pain feels in the morning. And when they see the X-ray, and a GP takes an X-ray, and a family physician takes an X-ray, or the patient sees this X-ray, and somebody tells them that you have a bone growth inside, suddenly they start getting worried. The bone is growing and has severe pain. Is it something dangerous? It's something serious. So that's the time the patient starts flocking to Foot and Ankle Clinic. And then but in retrospect, when we tell them that this is nothing to be worried about, and this is a condition it's due to because of the inactive lifestyle, because of the obesity, because of the long-standing job, and they're okay. But from there, it starts. That is how to treat it. Next slide. So next slide. So the main treatment when it comes to the plantar fasciitis, that's the heel pain, is the primordial treatment is exercises. That is the stretching exercises. The stretching exercises will be taught by a physiotherapist to you, and it is the compliance that is the most important. Many patients, they do few days and then they get better and they stop it. Again, it recurs. So the compliance is the one thing. And anyway, our physios are going to explain to you what are the different exercise modalities and different types of treatments are available. And second thing is the night splint. One of the very, very effective treatment in treating plantar fasciitis is, as I explained earlier, when we sleep or when we sit in office, our foot goes into the plantar, it drops down, and thereby the contracting the foot muscle and the calf muscle. But when you keep a splint, that is in the night when you're sleeping, it continuously kept stretched, so that in the morning when you get up on, so there is no contracted muscle that you need to stretch. It is already stretched. So when you start walking on it, you may not feel any pain. So it's one of the very effective mode of treatment. But many people come back and complain that they're not able to sleep with this splint. But some people are very compliant and very good results. Of course, we are going to give you pain medication, and that will relieve a lot of pain. But you cannot continue this pain medication for long. So you need to depend on mostly on the physical exercises, night splint. And if you are a patient with a flat foot, you may have to start using a medial arch. If you are a patient who has the problem with the orthotics, that is you have recently changed your footwear and you're not able to wear that footwear properly, it's not suiting to you, you may have to change a footwear. So even change in recent footwear, which is ill-fitting footwear, also is one of the reasons for the plantar fasciitis. Then comes once the patient, how long you need to continue this physiotherapy, how long you continue the night splints. The person is, it is not typically I can say that, okay, 2 months or 1 month. Sometimes it may be even 3 months. So one of the main important things in this treatment of heel pain is patience. A patient who has a patience, who continues to be compliant for 2 months, 3 months, is going to have a very good results. Otherwise, you may have results earlier and you discontinue the treatment, and again the complaints will come back. But the problem is when you have a repeated waxing and waning, that is you have remissions and again reappearance. That is the time when there is a repeated inflammation and there can be a weakness in that particular foot muscle or the calf muscle, and it may even tear sometimes, and you end up in a surgery. So, okay, will all get relieved with the physical therapy, with the night splint and with orthotics? May not be. 80 to 90% people get better with the physiotherapy. but maybe 10 to 15% people may not get better. Then in that case, what we do is a second line of treatment. We give a local, a mild steroid injection. So people get taken aback when the moment you say steroid, but this is a very safe steroid. It's not going to have any systemic problem and side effects, that you don't have any other effects on the body. It acts only locally, and it's going to give a very good relief of pain. But once the pain is relieved, many patients, we have seen in our studies, 40 to 50% of people just stop doing exercises. Injection is not a panacea. Injection is not the treatment for complete healing of this problem. The complete healing happens only with the stretching exercises, with other modality of physical exercises, weight reduction, and all that. Injection is an interim measure to reduce the pain, so that your activities of daily living are not affected, and you can do exercises more effectively, so that you get a permanent relief. Okay. And with exercises, with the injection, patient is going to get complete relief of? May not. Maybe 5% of people may still have some pain. So in that kind of population, about 5% of people who doesn't get better even with injection and with physiotherapy, we may have to go on to a surgery. What we do in surgery, we just release the tight structure that is in the foot muscle, that is a plantar fascia. It can be done endoscopically, arthroscopically, or it can be done even in a small incision open procedure. It's a daycare surgery. You come in the morning, get it done, and go back in the afternoon. But you may have to be in a rest for 2 weeks to 3 weeks, and after that you can walk comfortably. So in nutshell, plantar fascia heel pain is a very, very common problem, and it's not a serious issue. And one of the main reasons is obesity, which is very much increasing in our population. Second is inadequate exercise, inadequate physical activity. And the third thing is long-standing professions, like you have teachers, you have cooks, you have bus conductors, where you have to stand for a long time, and you have to thereby increasing load. You have to pass a lot of stress through your heel. And the main treatment is a stretching. And second thing is the night split. And the third thing is the medication. So don't depend on the medications. Injection is only an interim treatment to relieve your pain. But if you want a long-standing complete relief, it is the exercises, it is the splits. And very few people with this condition may end up with for a surgery. So I hope I made it clear, and our physio department will now explain to you what are the different modes that we have in our physio department to treat, and different modalities of treatment that we have in our department.
Thank you, Dr. Vidyasagar.
I'm going to demonstrate how you can do a calf stretch. If you can see, I have a board over here which is used specifically to stretch a calf. Anybody can make that board. Just have a 60-degree angle placed against the wall, and the arm, the leg which is affected, have it placed on them. Knee has to be straight, and use the wall to support and move your body, particularly your hips. A lot of times you find people moving their head closer. That's not going to stretch much. So keep your body and move your hip as close as possible. And the important thing that you move for the stretch is, as you move, there will be a feel of stretch. And if you move faster, you will go till the end and you might feel pain when there is an acute inflammation. So what you need to do is hold on, start going slow, and as you start feeling the stretch, hold on to that place, because that is your zone where the muscle is actually stretching. If you try and go further more, it might cause pain, where you're stretching and the stretch is going on to the inflammatory area and it is causing some discomfort. What you feel the stretch and pain is the zone where you need to stay. And what you need to do is you need to hold there at least for a minimum of 20 counts. A lot of the time people just stay there and just come back in about 5 counts. That is not required. Now, if you don't have a calf board, you can use a wall. One way is, this is my affected leg. Keep the affected leg behind. The knee is straighter, foot straight, hold the body, and then just go forward. Now, people who have very calf, too much of tightness will start feeling the stretch straight away. They just hold it for again 20 counts, then come back. A very strong stretch. You use your affected leg, put it on the wall, on your feet. You get a nice foot into flexion. Use the wall for support. Other leg and push your body forward. Go forward, hold it, get a nice stretch. You can feel sometimes the stretch coming from just above the heel all the way to the knee joint. Hold it for 20 counts and come back. So this is calf stretch, how you can do in standing using a wall support. Now I'm going to show you something how you can do on lying. So I'm using a belt. What you can do is use a towel, a dupatta, or old belt, or a belt from home, or a rope. So use anything. You might have seen a lot of the times people having pictures or videos where people sit and just pull. Now, we prefer lying down. This one is not going to give that much effective stretch, but for people who have got a very tight muscle, sitting itself is good enough. So remember, I'm going to use my hand strength to pull so that the foot is getting stretched. If I can't use my hand strength, use your body and lean backwards. So that force will act upon the calf. The other variation, lying down, lift it up. Now, as you lift up, there will be one particular angle where you will find the calf stretching very nicely. Hold that position and pull it towards yourself. Now you need to hold it for 20 counts. You can also move your leg on each direction so that different fibers of these muscles get stretched. This is again a very good exercise to stretch the calf and the hams together. So this will be an active exercise. I can also progress it to holding for 10 counts, and I can also progress where I can ask them to move their feet so that I get a good stretch coming along the muscles. Now these are the stretching strategies. For strengthening, I'm using a resistance band here. It's tied onto this bench. You can tie it to your dining table or your cot or a chair, or you can have anybody holding them. So this is the opposite group of your calf muscle, which has to be strengthened. So you hold them and start moving it towards you. There is going to be a very small movement, maybe about 2 to 3 inches. That's it. You need to strengthen your toe muscles. So I can use the same band. Now, we find mistakes, as Sir had mentioned earlier, that people tend to keep their feet forward. You will find sometimes people not able to do the toe movements, and they will end up moving the feet. So that's an indication, again, you are using your calf muscles too much. So you need to control that movement coming from the foot. It has to be only from the toes. People who have habit, when they sleep, their feet tends to be too much down. These are people who tend to complain that they get out of the bed and the first few steps is very painful. Now this is the ninth plate. You can see there. It's a simple plastic fiber and just got a strap to hold on. So this is something we recommend people who have got very severe pain and getting up in the morning. So they place it. So you will see that the plastic fiber places the foot straight and perpendicular. So when I go back to sleep, my feet is not going forward as I showed you. It's more straighter. So the muscle is maintaining a good lengthen. So when I get up in the morning, it is in a better position. And when I keep, there is going to be a chance of having less pain. So usually we recommend the patient to keep the belt also nearby their bed So when they get up off the bed, use the bed, stretch it there itself, and then get out of the bed so that they can be more pain-free. And most of the patients have better results in day 1, day 2 with following these simple things. And in order to sustain them, they will have to use the other strengthening exercises. And some patients might even require MCR footwear. You can see that it is a soft padded footwear. So for people who are going to do long standing, so this can help. And even for people who have the calcaneal spur, what sir showed you on an X-ray having a bone growth. And you can also use a silicone pad. You can see here, it is a heel pad. So this can be put on your footwear. So people who are in office, walking a lot, so you put the silicone pad inside, your calcaneum rests inside, and the point of excess pressure or the bone growth is sitting in, and that absorbs, the silicone absorbs the force. So that can give you a better chance to keep your functional movements going on day in and day out.